Hello and welcome to this edition of Bayou Time. I'm your host, Keith Weisheit, licensed clinical social worker. Thank you so much for joining us. And like we always like to do, finding out more information about what's happening with our health systems. We love and very glad to welcome into the program, joining us, CEU Greg Stock of the Thibodaux Regional Health System. Welcome to the program, Greg.
Thank you.
Well, listen, we're hearing lots of information and stories out there about what's really happening. Tell us maybe the status of how things are for you and your team over at Thibodaux Regional.
Yeah, well, it's a very challenging time for everybody, including us. Most of those challenges have to be with adapting to the number and the acuity level of the patients it's not a norm. The second is just having the number of staff that you need and the type of staff you need to take care of these people. That's our purpose, is to serve the people in this region. And the smaller hospitals that send patients to us, we want to be able to help them too.
Yeah, and we know that having a large number of COVID patients really impacts the hospital in a large way. Can you tell us how that maybe is impacting some of the other services, some of the ancillary services that y'all are trying to provide, and how it's impacting that?
Yeah, it's both well, I don't know, negative and positive, but here's the way it works, I think, operationally, is things like surgery services we have limited. These are mostly, almost exclusively services that can possibly be put off, surgical services, surgical procedures. And for example, if you're a pain patient, that's a hard call sometimes. But on the ancillary side, when you're looking at imaging devices, for example, MR, CT, and so forth, the numbers are down. So you can look at hospitals today. A lot of what hospitals do today are in the ambulatory sector of things. They're not all inpatients. 20, 30 years ago, it was the opposite of that. It has shifted. And so because people are concerned or because they just want to kind of isolate themselves, and for a lot of other reasons, you see the demand for ancillary services diminish some. On the inpatient side, it's kind of the opposite. So beginning with an emergency department that's packed, that has 7, 8, 9, 10 patients even waiting for an inpatient bed, these are very undesirable things. But the diagnostics and so forth that we would consider ambulatory type services mostly are for demand. And respiratory patients, respiratory staff, imaging staff, and so on are also in short supply, as well as nurses. So, it's kind of a balancing act. It's pretty challenging at times to sort of move things around, and I think we do that well. On the other hand, our staff, our leaders are pretty agile. We have people that work together as teams really well, doctors and staff, I might add, not just staff. And that's how we manage these fluctuations it's fluctuating on a much higher level, so to speak. The mean that's much higher than it has been in the past. And that's COVID patients, but look, there's heart patients, there's orthopedic patients, there's cancer patients, there's lots of different types of patients, and that care, we want to provide it in the best manner possible.
Well, you bring up a really good point. One of the things that Thibodaux Regional is often known for is your award-winning service and some of the things that you guys provide in the area. Knowing that, how is the morale? I know that we had a time where we picked up where there was a whole lot less hospitalization, sometimes even no COVID hospitalizations, and now with this influx of hospitalizations and kind of overwhelming with your staff, how are you guys doing as far as morale goes?
Yeah, well, we're not doing surveys. The last survey we did, we were a leading hospital in terms of employee engagement, employee satisfaction. We do those about every 18 months. But I think in reality, what happens in these situations is generally hospital staff on a mean, you can seasonalize it. We do all of those things. And we put other factors in there in terms of how we plan and budget and staff. Then along comes a very large wave of patients. If that lasts a fairly short or reasonable period of time, people understand that. When it goes on and continues on, and there's questions about how long it will last, it's harder, it's more challenging. But I think really the small things that our leaders, our frontline managers to me they're always critical to everything we do. And our middle managers, they're right there, and you're as good as they are. They're a good bunch. They're a really great bunch of people, and they do a jillion things, innumerable things, to try to keep the morale up, reward and recognition, give what we call wows. Wows are just little certificates, so to speak, that recognize that someone did that was small, but it's significant. To sustain high levels of patient satisfaction, that the patient experience is a good one, that's heart and soul to us. And we've been a 5-star hospital on clinical outcomes. We don't want those to slip. And when you stay riveted on those things, it requires a lot of effort. And so the culture of the organization, things we believe in most deeply, and how we act and how we function all come into play in terms of, can we sustain that excellence, and can we really deliver what we know we need to deliver.
We were talking a little bit about the impact of your staff and the impact of what's happening there at the hospital. Can you tell us a little bit about what you're dealing with regards to maybe the number of COVID patients that y'all are experiencing there at Thibodaux Regional?
Yes. So our census says, if you put it on a graph line starting about July 2nd to present, has gone from 2 or 3 COVID patients all the way up to plus 60. And as of this morning was a little lower, it was in the 40s.
Oh.
And so that's kind of the timeline, and that's kind of the number. We have a 46 critical care beds. 30 of those are brand new, very, very nice. And so, that census in the critical care unit varies quite a bit too, and is in part dependent on how many critical care nurses you can get. There's a real dearth of those, and everybody's trying to get them. They work very, very hard. We have a great group of them, but we wish we had more at the moment, and I think everybody does. Today in our hospital, there are 7 COVID patients on vents in our critical care unit. We've never run out of vents. We have plenty of vents. We had, the last the first go around, we acquired a lot of ventilators, and also the method of treating those patients has changed since the early days of when COVID first hit us. I think it's a much improved way. But we're also seeing patients that are younger, on an average scale, mean scale. They're about 10 years younger than they were last year for us. A few days ago, we had 16-year-old, 26-year-old, two women who are pregnant, expecting babies. So you see a gamut of things. It's quite different than what it was a year ago.
Yeah, and so I tell you, this Delta variant is one of those things that's really kind of thrown us for how we care for people differently. And like you said, it's a completely different paradigm, if you will, about how we're treating them and the way to treat them. I guess I'm excited about the low number of people that are in your facility right now, the low number of COVID patients, and that relatively low number of patients on vents. And so that's the good news. And the bad news is it takes those very specialized critical care nurses that have to have some very specific training to be a critical care nurse.
Yeah, they're always like gold, honestly. I don't want to, though, move too quickly away from also the medical surgical floors, where we have a floor that's just COVID floor only, and it's like 30 beds, and that stays full. Those nurses that work on that medical floor are also, they're pretty specialized in certain ways. They have a lot of knowledge of COVID. They have a great attitude about it. It's interesting to go on the floor. I go on there and talk with them. They haven't lost it. They're cool-headed. They're very focused. They're upbeat. It's challenging, not easy. It's not a walk in the park. And sometimes they're tired, you know, they've been at this a while, but I'm really proud of what they've done and what they continue to do, and it's very inspiring to watch them, and they see things when they care, they do. It's demonstrated in the way they treat the patients in addition to their clinical competence. It's painful to see people not always do well. Some people die. And so hospitals are amazing places in that regard, and COVID puts a sharper emphasis on it.
Well, it's a really good point to bring up those particular med-surg beds, because very often on that particular floor, they're seeing the same kind of complications, and that's where your two teams work really well together about whether or not they are able to sustain themselves on the floor or if they have to go down to the unit. And very often it just requires two specialized teams to be able to do that together.
Yeah, and with our pulmonologists, our infectious disease doctors, and others that work really well. For example, they have huddles. They huddle. They discuss those patients, and they discuss outcomes and how things are progressing and what they might need to change. The other thing is, now hospitals are full of kingdoms a lot of times. I don't like kingdoms. I try to break them up if I can, because they're not responsive, largely speaking, to the needs of the patient. So what if you have, as much as you possibly can, one team? And so wherever patients need to go, wherever they need to be moved to, this team is working together with the other team members and their doctors and staff. And you have this sense of teamwork, and the patient is the center, is the focus of it. That's what we try to do. And I think that the clinical outcomes, I said we're a 5-star hospital, the only one in the state of Louisiana, that meets these high levels of clinical standards established by the government. You don't fall there. You get there in some ways in a different way than people think, but teamwork is one of the critical aspects of it.
One of those things that we've been talking about, been looking at and thinking about vaccinations, and I guess one of those things that we're seeing that's pretty consistent there with your hospital is the number of people that are vaccinated versus unvaccinated, pretty consistent with what we're seeing in the state, right? Yeah,
that's true. There are more people that are hospitalized who have not been vaccinated than those that have been, yes.
Okay. And speaking of vaccinations, that's one of the things that's important to you and your team over at Thibodaux Regional about your staff being vaccinated. Let's talk a little bit about what the messaging has been about vaccinations.
Yeah, I'll talk first, if I could, for a moment or two about philosophy, people's outlook. I had one of our young nurses stop me a couple of days ago down in one of our critical care areas and say, "Greg, are we going to force the staff to be vaccinated?" And I gave her my opinion, which I'll relate to you right now, is we're kind of opposed to that. It's based on the concept of people are smart enough to make their own choices, and it's not our role to be the Gestapo, so to speak, in that regard. Now, here's my own opinion of that. You should consider being vaccinated. I had COVID. I was diagnosed on Christmas Day last year, and after recovery, I guess, I had the vaccine. I made that choice. I don't particularly like vaccines, but I did. And I think that reasonably thinking, it's the alternative we have today. It's not perfect. It's not an assurance that you won't get COVID, but it helps. And I would encourage people to think about it. Our own staff, we've approached mostly through education that we considered solid information. I think part of the problem is the amount of disinformation or partial truths or whatever you want to call them that have circulated from the beginning to make people wonder and doubt. And of course, there are other reasons other than information, but to the degree that we've become educated and understand it better, we're better off. So we're between 50 and 60% of our staff have chosen to be vaccinated. And we'll continue to work down that road. That's where we stand on that.
It's really interesting. You and I have walked a very similar path. We both had COVID and exposed to COVID at Christmas time. and then both got our vaccinations once we were cleared to do that thereafter. And so it truly is that personal decision about what people want to do. And I think it's important for people to realize that they have the option to do that, and we can support whatever their decision is and still provide good quality health care for the people that are coming in to get care at your facility.
Yes, you know, we do the vaccines 7 days a week, and we're trying to make it as available as we possibly can to people. We think that the feedback we've received on the way we organize and administer it is good, very positive, and we want to continue to be a resource to the community. We do screenings in our tent around in front of our ER. You know, there's literally thousands of people that come through an emergency department, and of those screened in an ER, 19% of them are positive. These are people generally that come in with symptoms of COVID, so there's some indicator of it. But of all those tested, 19% test positive. It's not always what you think it is. And so we also do Regeneron. We administer that, and we make that as accessible as we possibly can. It's open to everybody. And you know, we've done hundreds and hundreds of those, and we continue to do those to help the community.
Well, and being able to do that, it's important that people know how to go about getting that. I want to give that number out for people that are interested in getting vaccinations there, which you, again, said y'all do often, 985-493-4464, is that right?
Yes,
493-4464. And just so people have that number, and so it's available for them to be able to do that. But it's a really good point to mention the tent that's over out in front of the hospital, and some of the physical changes that y'all have made to make the changes that are needed to really help people to get what they need evaluated. You're talking about 1 out of every 5 people with those symptoms who are coming in that are testing positive for COVID, and yet we're able to see that and maybe get those people treated out in the community versus them getting worse to get into the hospital. So we're getting that information ahead of time and early.
Yeah, I think the concept there is to get upstream on this issue. You know, what I noticed that happened to me personally is at first I felt pretty good. And then for me, the oxygenation just kept going down and got to a point where it's a little bit scary to go to sleep at night. And I've seen it in others in my family, young, healthy, very healthy people that work out, where at first it seemed good, and then it got better, not better, worse and worse, to the point they were hospitalized. So you don't want to be in that situation. And getting upstream with vaccine, which is not an absolute guarantee. We have one of our key staff members who was vaccinated that has COVID right now. And the wisdom there seems to be, if you've been vaccinated, that it lessens the effect of COVID, even if you get it. But a small percent still get it. So you're just turning to your best alternatives and try to protect yourself and your family from what's out there. And I'll say this, who knows who has it? And there's so many people that have it that really don't demonstrate the symptoms. You can go almost anywhere and be exposed to it. Right. So it's a good idea, again, I think, to me, to be able to be vaccinated.
Well, we certainly appreciate your time and all the efforts that's being made over at Thibodaux Regional. Thank you so much. We appreciate it.
Thank you.
Yes, sir.
Thank you.
All right, and again, Greg Stock, CEO, Thibodaux Regional Health System. That'll do it for this edition of Bayou Time. Don't go anywhere. More local programming when we continue.